We go to community spaces like libraries and shopping malls all the time. What if we brought healthcare into these spaces? For people in the community who are hard to reach but most need care, health systems should look into the community for partners. In our article, we describe 8 different types of partnerships between hospitals and local community entities, including libraries, places of worship, laundromats, barbershops, fire departments, police departments, dollar stores, and shopping malls. My name is Sanjay Lechman, and I'm a medical student at the Icahn School of Medicine at Mount Sinai in New York City. And I recently completed a health policy fellowship on both the House Ways and Means Committee and with U.S. Senator Bill Cassidy.
Hello, I'm Len Berry. I'm a professor in the Mays Business School at Texas A&M University, and I'm also a senior fellow at the Institute for Healthcare Improvement. I'm co-author of a new article just published in the Mayo Clinic Proceedings entitled Community Health Partners in Unexpected Places. Many people face barriers in accessing health services. What if we could deliver basic health services, for example, health screenings and health education, in places outside the walls of a hospital or a medical clinic, places that are convenient and not intimidating to patients? Our article addresses these issues, and one of my co-authors, Sanjay Lechman, he's going to tell you more, and then I'll come back with some closing comments.
In our article, we describe 8 different partnerships between hospitals and local community entities. These community entities include libraries, places of worship, laundromats, barbershops, fire departments, police departments, dollar stores, and shopping malls. And the one theme that ties all 8 of these community entities together is that they're all trusted services that we go to frequently. We go to libraries, shopping malls, and barbershops all the time. We feel safe in these spaces. By partnering with these services, health systems have a chance to serve people who most need health services in places they already trust to meet their other needs. We have really powerful examples for each of the 8 local community partners. And let me just give you a taste of one by discussing how fire departments can partner with clinicians and hospitals to improve health. Fire departments are among the most trusted services, with 80% of Americans reporting that they trust firefighters and other first responders. And actually, the fire department of King County, Washington, runs a program that we talk about in our article called FD Cares. And the FD Cares program is aimed at caring for people who frequently use 911. Before this program started, about 40% of all 911 calls in this community came from 1% of the community. So as a special unit of nurses, social workers, and firefighters, FD Cares works to address the chronic health and social issues facing this population group for non-emergencies, so that those expensive emergency resources are not unnecessarily deployed, so that emergency rooms are less overwhelmed, so that patients avoid ER-level medical bills when they get to the emergency room, and so that taxpayer dollars are used more effectively. Since FD Care started, they receive about 2,600 calls a year, and it's estimated to annually save the fire department about $600,000, save the local healthcare system about $1 million a year, and reduce ER visits by about 200 every year. And I want to emphasize just one more point, and that's that nonprofit hospitals are required to provide community benefit to keep their tax-exempt status. So a great place for nonprofit hospitals to look to when they're deciding what community benefit programs they can spearhead to maximize community impact, they should look to these community partners, like libraries, like barbershops. They should think about how they can reduce disparities by partnering with these services to bring health education and health services to those who need it most. Next, I'll pass it on to my dear college professor and friend, Dr. Berry.
Thank you, Sanjay. Great ideas without an effective implementation will fail. We devote the last third of our article to guidance on implementation of the ideas that we discuss. Implementation needs to be well planned, and specifically we discuss 4 steps. First, programs need to be co-designed. They need to be co-designed between the health system and the non-traditional partner. That's so important in creating trust-based partnerships where you have everybody in the room designing the program. Second, good marketing is essential. It's essential to create awareness. It's essential to create use of the services. People need to know about the service once it's available. Third, you need funding. Funding needs to be procured, which often requires creativity, persistence, and evidence. And last but not least, number 4, operational issues and challenges need to be resolved. For example, where in the library are you going to provide your blood pressure screenings? Where are you going to do that? Where in the library are you going to hold your health seminars? Who's going to train the staff in the library? Who's going to train the staff? There's so many implementation issues that need to be resolved and ironed out. You can find guidance in our article about these issues. We hope you'll look for our article in Mayo Clinic Proceedings. Again, the title is Community Health Partners in Unexpected Places. Thank you.